The femur is the longest bone that we have in our body, and it's also the strongest and the heaviest. So going through the structures now. Here, what we have is the head of the femur, where it will articulate with the acetabulum of the os coxae. Within the head, there is this small depression that I'm circling here, and this is the fovea. And at the fovea, there is a small ligament that will connect the head of the femur to the acetabulum of the os coxae. Then distally to the head, we have the neck, here in red, of the femur. And you'll notice that the head and the neck are slightly at an angle. And the important thing here, when you compare it to the shaft of the femur, is that it helps to bring the knees closer to the midline. Then stemming from the proximal end of the femur, we have these two massive and rough processes that are going to be our greater trochanter. Here I'm highlighting in blue. And then here we have our lesser trochanter. And these are going to be attachment sites for gluteal muscles and for thigh muscles. So one way to tell the difference in other than size is that the greater trochanter, this one is going to be more lateral, and then more medial is going to be the lesser trochanter. So when you stand up and you palpate your lateral thigh near the hip joint, you can feel this, and it's going to be that bony projection, and that's going to be the greater trochanter, because again, that's going to be lateral. Next, on the posterior side, what we have are the gluteal tuberosity, and again, you only find this in the posterior side because this is going to be the attachment of the gluteus maximus muscle, which is the muscle of what makes up your butt. Then we have the linea aspera, which is going to travel down the shaft of the thigh. And this is going to be continuous from the gluteal tuberosity, which will be more proximal, and the linea aspera will be more distal. And the linea aspera will be the attachment site for many thigh muscles. On the distal and inferior surface of the femur, we find our two condyles. And these are going to be smooth, articulating surfaces. And so our medial condyle will be that and the same side as the head of the femur, and then the lateral will be on the same side as the greater trochanter. And these are easier to see in the posterior view. Whereas with our epicondyles, these are going to be as well our medial and then our lateral side. And so here I'll highlight in this anterior view where these will sit on top of our condyles. So when you flex your knee, you can palpate these epicondyles in the knee on the sides of your knee joint. The patella is known as our kneecap, and it's this large and roughly triangular sesamoid bone that's located within the tendon of the quadriceps femoris muscle. So the patella allows that tendon of the quadriceps femoris to glide smoothly by distributing the force placed on the tendon, and it helps to protect our knee joint. There are two bones that make up the leg bones. We have the tibia and the fibula. Let's begin with the tibia, where this will articulate with the femur, the fibula, and the ankle bones. This is going to form the knee, the ankle, and the tibiofibular joint, and it is going to be medial to the fibula. So the tibia is the only weight-bearing bone that we find in our crural region of the body. It has this broad superior head with two relatively flat surfaces, which are the medial condyle and the lateral condyle. And these are going to articulate with the medial and lateral condyles of the femur. Next, on the anterior surface, what we find is this rough anterior portion on the tibia that's going to be medial and lateral to the condyles, and this is going to be the tibial tuberosity. And this you can feel just inferior to the patella, and it will mark the attachment site for the patellar ligament. Then, more distally, we find the anterior crest, or sometimes known as the anterior border or anterior margin. All right, and as you can imagine, only on the anterior side, where this will extend from the tibial tuberosity and is commonly referred to as our shin. And then lastly, what we have is the medial malleolus, which is a prominent and large process that you find on the medial side of your ankle. So that bump you're feeling, that's your medial malleolus of the tibia. The second leg bone is the fibula, and now this will be lateral to the tibia, and it does not participate in the knee joint. It's also non-weight bearing. Rather, it acts as the attachment site for many different muscles in the leg, and it helps to stabilize the ankle joint. So it is going to be long and thin, and again, lateral bone of the leg. We have the head of the fibula is going to be at the proximal end, and it is slightly inferior and posterior to the lateral condyle of the tibia. And then we have the lateral malleolus, and this is again what you can palpate at your ankle joint, and it's that lateral bump that you feel. The bones of the ankle are known as the tarsals, and so there are 7 of them. So there's 2 different rows that we see similar to that of the bones of the wrist. We have a proximal row of tarsal bones and a distal row. So let's begin with the proximal row. So the largest bone is going to be the calcaneus bone. And so this is what forms the heel. Then we have the superior most bone, and this is the second largest bone of the talus. The superior aspect of the talus then will articulate with the articular surface of the tibia, and then the navicular bone will be on the medial side of the ankle. And now we have 4 bones that will make up the distal row. So first we have the cuneiform bones. And the cuneiform bones are shaped like wedges that articulate between them and are positioned anterior to the navicular bone. So we have the medial cuneiform, we have the intermediate cuneiform, and then the lateral cuneiform. And then lastly, what we have is the cuboid bone that's going to be laterally placed and articulates with the medial surface of the lateral cuneiform and with the calcaneus. The bones that make up the foot are the metatarsals and the phalanges, where just like in the hand, these are numbered in Roman numeral 1 through Roman numeral 5, where Roman numeral 1 is going to be medial, and then Roman numeral 5 will be lateral. Then we have the phalanges that make up our toes, and similar to that within our fingers, we have a proximal row, we have a middle row for phalanges 2 through 5, and then all of them have a distal phalanx. Now, our big toe, special name for this, is our hallux.